Hi, everyone. Ooh, sorry. Just checking things on my phone. Turn that off really fast to avoid feedback. All right, and now we're good. Hi, everyone, and thanks for joining us tonight for the Healthy Communities webinar. This is going to be recorded, obviously, but happy to answer any questions at the end. Appreciate everybody taking some time to learn a little bit about the Healthy Communities program. And we'll obviously distribute this to the other area leaders that weren't able to join us this evening. So, pretty quickly, the goals for tonight's webinar are to provide some context for the Healthy Communities program and designation from SOI, to explain what a healthy community is and why SOMD sought out the Healthy Communities funding, to present SOMD's health and fitness goals and our programmatic priorities, and to share the major responsibilities of the Healthy Communities Director. That position description has been distributed and has been posted, but we want to talk a little bit about that. And then ultimately, major goal is to reinforce that we are still and will always be a sports organization. I apologize for the extra beeps. A sports organization first before anything else. So just to provide some context for why Special Olympics has embarked on increased health programs, healthy athletes, fitness, and those types of things. So I'm not going to read this word for word, but you can see in the infographic on the side of the screen, kind of the infographic about Special Olympics athletes. 4 have untreated tooth decay, 4 in need of eyeglasses, 5 have significant problems with flexibility, 4 with balance and placing them at risk for injuries, 3 fail a hearing test, 2 with low bone density, 6 are overweight and obese and at risk for chronic health conditions. So because we have so much contact with our athletes through sports programs, it is important that we take the health of our athletes seriously. So what is the Healthy Communities Initiative? SOI started the Healthy Communities Initiative with funding from the Golisano Foundation and the CDC, which takes the idea and principles of healthy athletes, which we've seen at a few of our events, most notably summer games, and expands them from a series of single events to a steady presence of health and wellness in the lives of our athletes. So health isn't something that we just do at summer games, but it's something that we need to take care of 365 days of the year. So a healthy community is a Special Olympics program like Maryland that embraces ongoing community integrated approach to facilitate athletes having access to health, fitness, wellness services, education, and support throughout the year. Again, not just at a healthy athletes clinic, but something that is infused into programming throughout the year. So as you can see from the infographic, the athlete at the center is impacted by their families, by technology, organizations in the private sector. And so the Healthy Community brings all of these entities together, universities, government, again, organizations in the private sector, to impact the health of our athletes and to promote healthy communities. You see the small circle at the bottom, that data circle. Special Olympics is the owner of the largest research database of health for people with disabilities in the world. And so that's through, the screenings that we do at Healthy Athletes, in addition to providing really good education and some kind of spot checks for our athletes. It also collects great data that we can then use to better educate medical professionals, students, and make an impact on the disability community. So the overall goals for the Healthy Communities program is to, like I said, offer continuous year-round health, wellness, and fitness activities for Special Olympics athletes. That's great. Activate community partners to offer prevention programs and health education for Special Olympics athletes. So just like we saw in the last infographic, this isn't something that is just done by Special Olympics, but it relies on community partners to engage in health education and programs. To that end, we want to develop partnerships that offer follow-up care for Special Olympics athletes who attend Healthy Athletes clinics. So as many of us have seen, one of the shortcomings of healthy athletes is that they go through this quick screening, they get their ears checked, their eyes checked, their teeth checked, what have you. And we haven't done an adequate job of saying, and you need to get this checked out, and here is a specialist in your community who can help with that. So Healthy Communities programs absolutely focus on follow-up care so that our athletes can, get the attention and the treatments that they need. It also encourages healthy lifestyles, again, that it's not just something that we do and care about at summer games, but health is something that we do 365 days a year. We engage leadership to train and empower athletes to serve as advocates for themselves and fellow athletes as it relates to health, fitness, and wellness. So the health messengers are an important part of the Healthy Communities program. We want to work with existing health systems to engage professionals in interaction with individuals with intellectual disabilities. So if you look at these infographics on the side of the screen, they're a little hard to read, but they say that over half of medical school deans and students report that graduates are not competent to treat people with intellectual disabilities. That number is way too high. From volunteering in Special Olympics, 84% of healthcare providers feel better prepared to treat people with intellectual disabilities. So we can see that this absolutely has a positive effect. We in Maryland want to make sure that we can continue to take part in that. So in addition to that, as Special Olympics Maryland has some goals. So through opportunities to improve health, fitness, and overall well-being, we want to ensure that athletes are able to find personal success in sport. There's a few models floating around the country where sport is an important part of someone's health. And as a sports organization, I think we need to flip that and say that health and wellness are an important part of our athletes' experience as an athlete. So we want them to find success in sport. So we want to make sure that they are improving their health, fitness, and overall well-being. We want to ensure that access to healthcare and physical examinations are not an obstacle for participation in Special Olympics. So we want to make sure that we develop the network and the opportunities for those physicals and med forms to be filled out. We want to engage the medical and healthcare community in interactive trainings and programs on topics of inclusive health and best practices in working with people with intellectual and developmental disabilities. Again, so it's as much as our athletes are benefiting from this, we want to make sure that the medical community is benefiting as well. We want to identify traditionally underserved groups of athletes and provide strategic outreach to improve access to healthcare. Again, we know that in some of our programs, the requirement of a medical is a challenge. And so we want to make sure that through MedFest and other programs, we can provide some strategic outreach so that in addition to having better medical attention, they can get those medical forms filled out and participate in Special Olympics Maryland. We want to nurture athletes to be self-advocates for their healthcare needs, certainly. And then the health and fitness industry in Maryland is huge. So we want to make sure that as we're doing all this health and fitness programs, we're leveraging these programs to increase sponsorship opportunities with Maryland's healthcare industry. So how are we going to do that? Programmatic priorities that we see, 5 big ones here. Athlete health messengers, obviously, as we continue to be on the forefront for athlete leadership across the country in Special Olympics. we believe that our Athlete Health Messenger program will be important to train in health advocacy and fitness education, using social media and in-person trainings, meetings, and those types of things. Our health messengers and ambassadors will engage their peers in interactive health education, including nutrition, fitness, and those types of things. So, really using our athlete leaders as peer educators, which will hopefully create more buy-in. MedFest, as we mentioned before, MedFest will be a crucial driver for our goal to recruit and retain more athletes by providing free physical exams to complete the required forms for participation, especially, as I said, in traditionally underserved populations. We will be able to register new athletes and retain those we currently have. We're going to target athlete reactivation, but we're also going to be targeting our Baltimore City and Prince George's County programs. Those are the areas that are probably most affected by the hurdles that the medical form can provide. So we're going to place emphasis there while also shooting to offer MedFest across the state. Third bullet, healthy athletes. The large competitions summer games will continue to have healthy athletes. We heard the feedback. We've tried it with different models. We will have more disciplines offered this year at summer games. So we're looking forward to that. We'll also look at the integration of healthy athletes in some of our single sport events, so that maybe it's not all 7 disciplines at one time like at summer games, but maybe it's one discipline at a bowling or 2 disciplines at winter games, whatever our clinical directors can be available for. Unified fitness, which we piloted this spring in Baltimore County, was pretty popular and successful. So we want to make sure that we're engaging our athletes in non-competitive fitness opportunities, whether that's biking, walking, swimming, hiking, anything like that gets our athletes out, moving, caring about fitness. We want to make sure that we're providing those opportunities. And as we saw in Baltimore County, it's a relatively it's high impact for our athletes, but low impact for our programs. They're pretty easy to start up, and there's plenty of funding available for prizes and incentives and all that good stuff. And the last one, which has been a new project of mine, has been performance stations. These are a relatively new idea for Special Olympics, and they link health and wellness to increase sports performance. So at competitions, we offer stations like hydration, nutrition, fitness, game day readiness, again, to connect health and wellness to improve performance on the field. Speaking of which, quick plug for those of you who are going to have teams at the 2019 soccer competition, we are going to be offering performance stations there. These are just some examples of what we're going to be offering down at Salisbury. So at the fitness station, we have some exercise science majors at Salisbury coming in to lead stretching and also cool down activities. So your teams, if they don't have the first game, they can come in, they can stretch. If they do have the first game, they can come back and cool down as they need to throughout the day. At hydration, we're giving away free SOMD water bottles that they can fill up and keep with them throughout the day and for their competitions and practice. Nutrition station is going to be run by University of Maryland Eastern Shore Dietetics program. They're going to be doing a really cool make your own trail mix station, so athletes can go down the line and have a bunch of options for healthy things to put inside of their trail mix bag. So excited about that. Competition readiness, we have some pre-competition checklists to help our athletes understand, their needs on the field, whether is it sunny and we need sunscreen and sunglasses, or is it rainy, so we want to pack extra shoes and socks and those types of things. In game day minds, we have some cool down and focus activities about visualization and get yourself in the right mindset for competition. So I think really interactive, fun, educational things to do. We did pilot them at cycling just this past week, and we had some athletes out there stretching before their races and getting free snacks and water bottles. So it's been a good time. Kind of practically, it also gives the coaches something to fill the day with. If there's some time between games, we all know that can be a challenge to fill time when we're waiting for that next game. So please encourage your coaches and families to come by the performance stations that we'll have down in Fruitland. So the Healthy Communities Grant, we applied and received funding for a Healthy Communities Grant for Special Olympics Maryland over the summer. It was a pretty big application process, but I'm happy that came through in the positive. Our grant funding will cover staffing and related expenses for a full-time Healthy Communities staff member, okay? The criteria is listed below. We need to make sure that we're doing at least 3 healthy athletes disciplines per year in the geographic focus area. So in Maryland, we want to make sure that we're having 3 disciplines. At summer games, we'll be able to knock that out, but hopefully we will exceed that throughout the rest of the year. The other one that I talked about with follow-up care, in a geographic region that we're identifying as Baltimore City, Baltimore County, if an athlete, 70% of the athletes who do need referrals, we need to make sure that they have a place for follow-up care after a healthy athlete exam. The 20% of our athletes in the geographic area participate in health and wellness programming outside of SO sport and healthy athletes events, so things like unified fitness clubs or Fit 5 challenges and that type of thing. And the last piece is sufficient sustainable resources to achieve the above criteria to deliver the project. So we're putting the grant funding into the staff member so that we have someone to do this, and we need to make sure that we are able to generate resources to make the program go. So the responsibilities of the Healthy Community member, with all that being said, they're going to manage the Healthy Communities Grant and all of those related requirements. They're going to be having a multidiscipline Healthy Athletes event at summer games and single discipline events at other competitions around the year. We think that's going to be popular with our families and coaches, so that it's not just at summer games, that's the big one. But obviously throughout the year, it's not necessarily that 30, 45 minutes that they're going from station to station, but maybe it's 5-10 minutes, get your eyes checked, get back on the ski slope, just as an example. I'm not promising winter games by saying that. Growth of SOMD MedFest throughout the state, we think that's going to be really important. So that's going to be an emphasis for this individual that we hire. We want this person to work with area leadership to grow non-competitive fitness opportunities for athletes across the state. Our partners, families, and volunteers as well. They have this great model called Fit Families, Fit Friends, that's kind of fitness challenges for athletes and their families to take on together. We realize that a lot of times the more successful, as athletes embark on fitness or health journeys, they're more successful when supported by their family. So this kind of brings them together. We want this person to work with you in the area leadership to implement these programs. We don't want it to be taxing on you and your programs, but we do want to provide them for the athletes. Performance stations at selected events, again, that really good connection to health, wellness, to increase sport performance. They're going to be there to train and mentor the athlete health messengers, get them out in the community. And then lastly, medical staffing at competitions with our medical coordinator, Pam Greenwood, not just for, focused on state events, but certainly looking to develop those relationships with medical professionals throughout the state so that as other local program competitions come up, we have that good base of medical professionals to call upon. So the timeline, pretty short, but pretty straightforward. The position was posted on the 13th on the SOMD website, and indeed we've had a good number of people apply. While it was posted, I was out in Minnesota at the Special Olympics North America Sport and Health Conference and was talking to some people about the position, and there seems to be interest in some people across the country. It seems like in other SO programs, they do health and unified sports, or health and athlete leadership, or health and something else. But there seemed to be interest in coming on board for a health only position. So excited that we were able to do some recruiting out there and start those conversations. Applicants are coming in. I think post is going to stay live until the 25th, at which point I'll review all the candidates and do interviews in early November. And then depending on availability, we'd like this position to start in December 2019 or very early January 2020. So the person has a lot of work cut out for them in this new program. But again, we think that this is going to make a good impact in our current athletes, help us find new ones, and overall provide a better quality sport experience through the focus on health. Low participation tonight. So we had Pat, Ron, and Shelly. Unless it gets really crazy, I'm going to use line just to see if anybody has any questions about healthy, or we can say we're all good.
I'm good.
Okay, thanks, Shelly. You were really the one that I was asking for. So, well, Shelly, it's good to talk to you. Thanks for joining us tonight, and I appreciate you taking some time. You definitely tell your soccer coaches to come see us at Performance Stations this weekend.
Yes.
Okay? Cool. Thanks, Shelly. Thanks, Ron. Thanks, Pat. I'm going to go ahead and end the webinar so I can get this recording sent out to everybody. Appreciate your time, and we'll see you soon. Thanks, everybody.